Good Saturday morning to you, and welcome to the Sleep Show alongside Dr. Bethaney Brenner. I'm Gary Byron. Very easy to reach, 860-673-7155. Again, that's 860-673-7155. And online at the Burlington Dentist.com. By the way, if you want to send an email to the show, you can do that very easily. Dr. Brenner Radio, Dr. Brenner Radio at gmail.com. And I know I whipped through all of those points of contact, but the good news is I'm going to offer those at least a couple of more times before the show is over. Doc, good morning. Great to see you.
Yeah, you too.
How was your week?
You know, it's always interesting. I'm always learning something new, and I think that that's what keeps me going.
I think that's what keeps all of us going.
Well, you know, I get a
we
patient.
all like to learn something new.
I get a patient in, and it's like trying to figure out what's wrong with them, and some are easier than others,
Sure.
and some
Makes
are just a little complex of stuff, and then, you know, you sit there and you go, well, let me read about this a little more, and then I look into things and get more testing, and it's, to me, it's like, I think I've got it, you know, so to me, that's very satisfying.
Have you ever come across a real serious challenge where, oh my goodness, you strike me as a person that's determined. Not that you're going to give up. I don't think that's in your DNA, but something that's really challenged you and maybe took a little longer to figure out than you thought.
So I sit in groups nationally. We have meetings, and our group leader, Dr. Joe, he starts at 9 o'clock in the morning on a Sunday morning, and he's in California time. So that's noon for me. Mm-hmm. And he's always got a subject matter, and we have some very interesting people that participate in this. And we've been doing this since COVID. So it kind of started it, and we were kind of meeting more frequently and doing things because we were shut down. And then you sort of get a core group of people. So we actually have ENTs, we have emergency room docs on there, we have a lot of sleep dentists, and then we have people who do myofunctional therapy, speech pathologists, and other dentists that treat. And it's a really fascinating group of people with a lot of information. And so I always feel like I have backup that I can always say, hey guys, what do you know about this? And then they all start, did you check this? Did you ask that? Oh, yeah, don't worry about this. You know, it's a really good group of people.
That's great.
I don't use it too often, but it's when you hear other people ask questions, you're like, oh, yeah, that's a really good, you know, something to know, tuck away.
I'm amazed just to know that more people suffer from sleep disorders than meets the eye.
Oh, yeah.
I mean...
And it starts at a very young age. It starts when there's babies, really. So this is where, you hear about, breastfeeding's really good because they get more nutrients from the mother's milk, and it's better for the baby's system. They don't have gut issues, and they don't get colicky, unless the mother's eating something that upsets the child. But that's not the only reason. The breastfeeding actually helps develop the face. And the child has to work at getting the milk out of the breast. So there's a jaw movement that they do, which actually helps grow the face. And then for us, it keeps them, they develop a strong tongue, and they get it up because the mother's nipple is compressed to the roof of the baby's mouth so that they can milk the breast, so to speak. Mm-hmm. So when you see children who posture open and they can't keep their mouth closed while they're sleeping, that's a very weak musculature, and it starts to set the face growing in a different direction.
Oh, wow.
Yeah. So it's really important that babies sleep with their mouths closed.
How common is that?
So you just think about what you see for advertisements, or when they have pictures of kids in a cartoon, not a cartoon, but like an advertisement for baby food or milk products. And I used to look at magazines. Of course, we don't have too many magazines anymore, but you'd look at the children, the babies they would take pictures of who had their mouth closed. It used to be all of them. Now you see maybe one or two with their lips closed. So more and more children are breathing through their mouths, which sets up the breathing improperly and the face then develops differently.
Oh, wow.
I know. So it starts really so I tell my patients who come in, just take your finger and close the baby's chin to the lips touch and see if they'll stay there. And then just keep repeating it because you'll teach them to breathe through their nose.
Tell me a little bit about sleep studies. Have you ever had one yourself?
Oh, yeah.
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 At home or in a like at an office?
So no, I don't. They call those clinics where you go in and you're there overnight and they videotape you and they use EEG. It's a more sophisticated sleep study, and there are some people that really need that. Okay, because we don't have a lot of people like that, but there are people that do need
So not
that.
all your patients are subject to a sleep study then?
I would say yes, they are.
Oh, they are? Okay.
Yeah.
Okay.
If I'm going to treat them, I need a sleep study. So we take a good comprehensive medical history. I check it out with the sleep physician that I work with, who then authorizes the sleep study. And then we facilitate it by giving them a ring. So the ring slides on their finger and Bluetooth to their smartphone.
Oh, like one of those things
Yeah.
you go to a doctor and they put that...
So it's a big size, it's a pretty good size ring, but it's
Okay.
a very sophisticated piece of equipment. So there are some sleep studies where you've got two belts and a big computer that sits in the middle of your chest, and you've got stuff that comes up over your ears and into your nose, and they tape it on your face, and then you got another lead that goes down to your finger. Those so it depends on how many, what they call it, channels that they're recording. So sleep is complicated. And so you
it
need the
shouldn't be,
information.
though.
You would think, but everybody's not the same, okay?
Thank God for that. So you were talking about a moment ago about jaw development and how it could lead to sleep apnea.
Right. So I have a really good friend. He's a dentist, but he's also an anthropologist.
Oh, no
Very
kidding.
interesting man.
Yeah.
He's a pediatric dentist. And Dr. Boyd, Kevin, he did a study where they took skulls of children and they put them through a cone beam, which is like a 3D X-ray, and they scanned all of these skulls from children who had died in the first year of life. SIDS is a typical sudden infant death syndrome. So they took all these skulls and they scanned them, and then they scanned other normal children, right? And they're looking for what happens to the face in that development. And so one of the conclusions that they came to was they can now use, is it a level 7 or 8 ultrasound that they do when mothers are pregnant, and they look at the angle of the jaw now, and they can predict whether that child's going to have a breathing disorder upon birth. And so
How accurate is that prediction?
it's pretty good.
Really?
And so the woman who was in charge of the Harvard Pediatric Sleep Unit, I don't know if she's still there, but she gave lectures like 20 years ago talking about that they did not believe that sudden infant death was what they thought it was. They thought it was sleep apnea in infancy, and the child did not have the reflex development yet to open their mouth and breathe. So, we used to say, oh, you put them on their stomach, you put them in the wrong place, and all these baby monitors that got, you had to watch the child 24/7. And it really is about the fact that they need to breathe. And so some people's airways are not developed fully. I had a woman who came down from Boston to have me work with her. And there's a really great ENT up in Boston, Dr. Peter Catalano, who I've worked with. And he's one of the few ENTs that understands sleep breathing issues. And he's a big proponent on making sure the airway is properly developed and cleared, for issues. So I sent her to him because it's right around the corner from her. And I said, he needs to take a look at you because from my perspective, I don't know that I can help you the way you need to be helped. So she went up to see him. So he did some specialized test on her, and he said her airway is so small that there's no way he can fix her either, because it's not the nose per se, but it was how it goes from where the behind the nose where the adenoids sit all the way down her throat.
Oh, wow.
So she was so tiny that there was no way to expand that. We couldn't, even if we brought her jaw forward, that was not going to change anything. So some people really do have an anatomical problem. And this is where Kevin started doing these studies, Dr. Boyd, and he gives lectures and he participates in this. So it's really important that we look at getting these children to breathe through their nose from birth, to try to get them to breastfeed if possible. And we know there are reasons why some of them can't, but we want to make sure that they start to develop that ability to breathe through their nose, because it does change how their face develops.
They tell athletes to do the same thing. If you're, especially runners, if you're huffing and puffing,
right,
breathe through your nose.
Right.
It'll help you.
So the Olympic track and field people have been using lip taping for several years now.
Wow, that seems extreme.
In training. No, they train that way. So I've used that with some of my patients when I had a woman who was a rock climber, and she'd start to have a panic attack. And I said, well, you got to breathe differently when you're having a panic attack. This is what you would do. And she's like, she's like huffing and puffing through her mouth. And I'm like, nope. So I said, this is going to start before you ever get to the cliff, okay? So I said to her, do you run on a treadmill? Do you run outside? I said, start lip taping while you're doing that. You're going to train yourself to breathe through your nose. So the first time she did that, she called me. She was all excited. She's like, oh, my God, I ran for an hour. She said, normally I can only run for a half an hour. She said, but I just kept running because I run until I'm tired. And she's like, oh, my word. It's like I ran for an hour. And I'm like, I can't believe I did that. And she didn't have the same after effects. So I said, okay, keep doing this, right? Because you're training your body to breathe through your nose. And so I said, and so when you get out of the car and you're walking toward this cliff, because that was the whole purpose to get her to climb the cliff, right? I said to her, no breathing through the mouth. Okay, you're going to breathe through your nose, the walk all the way to the cliff, and as you're going up. And so she said she got into the middle of the cliff. She said, I thought I was going to have a panic attack, but she's like, I'm breathing through my nose, and I'm trying to just take breathing through my nose. And she said, and then it passed. And she said, I was able to complete the climb.
Look at that.
So that was a win, right? And so they're now working with these guys in track and field, and they don't wear it while they're running in a competition, but
I'd be blowing out boogers and everything snots from my nose as I'm running. That's my kind of luck.
That would be short-lived, because you do train yourself to breathe better through your nose.
Let's go back to this sleep study that I was just talking about. What score is okay in a sleep study? Let's start with children with sleep apnea.
So 0. They're supposed to have no sleep apnea as children. So if they score a 1 or a 2, that's not okay. There are some children who, and you'll see them in the news, especially because they make a big deal out of it, but they're obese, okay? And of course they blame it on the parents, and some of it's possible there, but I think some of the media overhypes that. And so with some of these children, they've actually put them on CPAPs. And it's interesting because I had a patient who came in recently who cleans homes. And she's like, she said, the parents are on CPAPs, and she's like, and the kids are on CPAPs. And I said, the children? She goes, yeah, they're like elementary school age. I said, so here's our problem. It improves things for a very short time, and then they go right back to having sleep apnea issues. And so there's some controversy in the fact that how is that face going to develop properly if we're wearing a CPAP, okay? So there's and that's not my call. That's a sleep physician's call. I don't do these children in those particular situations, but I do recommend that we have a different method of propping the airway open, and we work on teaching them, and it's called Butico breathing methods, where they learn to breathe through their nose and they learn to clear their nose. So I can teach a 5-year-old how to clear their nose if it's stuffy. Okay?
Well, would you just blow your nose?
They can't blow their nose. The kids don't blow their nose. They have to. That's a learned technique. Uh-oh.
Well, it's a learned technique. Blowing your nose.
Yeah.
Yeah, okay. So
so try telling
everything is a learned technique.
Yeah,
it's just a matter of
tell a 2 or 3-year-old how to blow their nose. They don't. They just kind of go, huh? They don't do it. So with a 5-year-old, it's still difficult to do.
Okay.
Anyway.
All right. Well, no, I'm having a hard time thinking that.
So children can learn how to
can't-
clear their nose. Now, if I tell an adult that, they're like, I just blow my nose, right? But does that always clear the nose? So there's ways.
How about one of those Vicks?
Okay, so you don't need the Vicks. You need a sterile saline solution. Okay, so there's something about when you use salt water. First of all, it doesn't burn when you spray it up your nose.
Like a Flonase or something? Or?
That's not sterile. So something called it looks like Xlear, Xlear. That's a sterile saline solution. And interestingly, I had been using that prior to COVID with my patients. Some people have had nasal surgeries and they get created what we call an open nose syndrome. So they really can't control what goes on in their nose. So they have to flush their nose twice a day to keep from getting sinus infections. It's sad, but some ENTs just sort of blow out the whole complex in the nose. And then we're talking they didn't have a sinus tumor or cyst or something like that. In these situations, when they were using the clear, and that's how the Scandinavians pronounce it, before COVID, they did fine. Everybody was on that. So COVID happened. None of my patients who were using the clear got COVID. Not one of them. The families got it, and they didn't get a thing.
This is over the counter?
It's over the counter. You can find it in Walmart,
Clear.
CVS. Yeah, you can even find it in Big Y. It's always on the bottom shelf. I like to say to my patients, in the dust balls at the bottom shelf, because they don't pay to be higher up on the shelf. But that stuff really works. And they did multiple studies during COVID to prove that this not only kills off bacterial infections and prevents you from getting sinus infections, but it also kills off viruses and fungus. And interestingly, the FDA would not let this company put that information out during the first year of COVID. They forbid them to advertise.
Why?
Well, there's the question.
Well, the same thing with ivermectin, right? They wouldn't even let that go out.
There was
Only
a whole
a few doctors.
hydroxychloroquine. You were fired if you ordered that for a patient, and yet we have that malarial drug going around. So I used to say it's very interesting. Like all the people who have lupus were on hydroxychloroquine. None of them got COVID. And notice that in the countries that use this, and Africa's a pretty big one, they didn't have major COVID in Africa.
So what does this all tell you?
No, that's a political question, and I'm going to stay away from that one.
Folks, you are listening to The Sleep Show along with Dr. Bethaney Brenner. I'm Gary Byron. You can find information online at theburlingtondentist.com. And hey, how about this? Write this phone number down. You can call it right now, I suppose, but I don't want you to miss any of the show. So maybe call it in 10 minutes. 860-673-7155. And if you're busy in 10 minutes, call it today, call it Monday. Just make sure you do call it. 860-673-7155. And you can send an email to drbrennerradio@gmail.com. That's BRENNER. And if you missed any of that, I will get one more time before the show's over to all those points of contact. You mentioned something about obesity a little while ago and how that could actually affect sleep apnea. So how does diet shift children into sleep apnea?
Well, there's the complex question, because people learn how to eat from their families, right? Mm-hmm. Traditions, what kind of foods that they cook. So you think Mexican food, you think...
Oh, I love Mexican food.
What do they eat in Alaska versus what they eat in Hawaii versus what we eat in Connecticut. So everybody has native foods, right? And we all get into the mother's favorite foods, grandma's favorite foods, and they cook, and we love that, right? There's those traditions. But when you're eating in a way that doesn't develop the jaw, it's typically, and this is where there are some very interesting books out, and they talk about the historical facts. So there's a dentist that went around the world doing all these different different foods, different styles. What he found was when you ate whole foods, and you ate them and you had to really chew, okay, which meant that it was maybe a firmer, coarser type of food, not refined, not sugar-based, not, we'll just say really refined flours, because we grind our flours and we cook breads differently in the city than we do when we're out on a farm. Okay, we tend to use something more with bran. It's not so milled so finely. Those kinds of foods, and I see people that have come over that I've treated from Australia, and they don't have some of those refined foods out on their farms. Okay, so they grind it up kind of with a more I don't want to say archaic, but a different kind of system. They come in and their teeth are more worn down, but their faces are broader. Their teeth are straighter. And so this dentist started to notice that the kids who grew up in the country, their faces looked completely different than the kids that grew up in a city.
No kidding.
So the kids' teeth were more crowded. They were more narrow-faced. They were position of the teeth, their faces just were narrower, longer, more issues, okay? So there's an airway issue right there. So and then they moved this particular family that he took a picture of, and he kind of points out in this photograph, here are the kids that grew up on the farm first, and then you get 2 or 3 in the middle. They grew up in the city. Their teeth were all crooked. You could tell by looking at their faces. And then they went back to the farm, they went back to the country, and then the last child's teeth were straight. So it's how you grow up and the foods that you eat. So it helps you develop the face. So if you're giving a child something like raw broccoli, it takes a little while to chew it versus a cookie that's refined. Okay? And I'm not saying that everything's always a cookie, but the when you have to work at chewing the food, the child's face develops better. And we tend to see the broader, so the tongue has to go up to the roof of the mouth when they swallow. That helps widen the upper roof of the mouth, which is basically the floor of your airway. So think of it, the sinuses sit right above those upper teeth. And when that happens, now we're functioning, the nose is working better because the tongue has pushed that bone in the development of the face so that it gets wider.
Wow.
Right. So you just look at, there's more room for the teeth. And so we don't see the same kind of issue. So I look to see, are the cheekbones fairly wide? Does the face look more symmetrical? Or do they have a very long, skinny face? So the long, skinny faces, you will see all of those people. Just think of your friends, right? Think of who you know, right? Who has trouble breathing through their nose? Who breathes through their mouth all the time? Who has asthma? Who has a lot of allergies? So those are little clues. So when I see the kids come in, the first thing I do is watch them. And so I know it sounds kind of crazy, but I watch them while they're sitting out in our waiting area, our reception area, because I want to see what are they doing without being asked. Okay? Now, I had one father, great guy. He's in newscasting, okay? Brought his daughter to me. He could not see how she was not okay. Even though I pointed it out, he's like, no, she always looks like that. I said, this is not okay. She's got asymmetries of her face, right? These are, I don't want to call them deformities, but then we can correct some of that. But she was extremely forward head postured. So when you get your head beyond your, we talked about this in a week or two ago, when you're forward head postured, you actually reposition your C1. So your head sits on the spine at C1, C2, right? Are you crooked? Are you forward head postured? Because that closes the angle when you swallow, okay? So now those people get more ear problems. So you get kids that get a lot of ear infections, look at their posture, okay? So then when you have obesity in this, right, where's the first place? And this is going to be kind of a sort of a funny thing because I tell all of my male patients, okay, you know how you're putting on your little tummy from all your beer? Guess where you put it on before you put it on your tummy? I said you put it on the back of your tongue. So there are fat pads back there, and those will fill in first before your tummy starts to look a little more protruded.
Incredible.
Right, so you think, oh, what does that have to do with anything? So that has to do with breathing again. So when they can't breathe well through the nose because that area is crunched down. So we'll look and we'll see a palate, which is like the roof of your mouth, right? How far does that go back into the throat, and does it look like it's almost touching your tongue?
You know what I find absolutely fascinating is how all of this are all linked together.
Yeah.
With it's
Yes.
it's amazing.
Right. Right. And so when I see people, and I love sitting in airports.
I remember you saying that once before.
I
Yeah.
love sitting in the airports, and I just watch people. So I watch how they function. I watch how they walk. Because my patients think it's weird. I have them take off their shoes, and they're going to stand over here, and they're going to do like a 360. They're going to turn halfway, right? So when I'm looking at their postures, I'm already assessing their spine, their neck, their cervical spine, and how their body is. And do they have like a sway back? Do they have the forward head posture? Is one shoulder higher than the other? One hip higher than the other? Are their feet pronated? Are their knees knocked in? It's really, posture is so much more important than we ever thought it could be. Now, I have a thing with chiropractors. But it isn't always a good thing. So some chiropractors are better than others, just like some dentists
like
are better
anything.
than others.
Yeah.
But the ones who are paying attention to fixing the problem, and you can't fix it unless the airway's okay. So you know how the chiropractors like having you come every week, and they're still working on you, and it's still the same, and it never gets any better.
Well, that's how they make their money. They're not going to cut that off. That's a revenue stream.
Yeah, so I look at that and I'm like, okay, so we're never fixing the problem because we never fixed the breathing issue. The head will automatically start to upright when we breathe better. I know. Wild, huh?
Man, we're out of time here, too. By the way, I didn't get a chance to. We just simply ran out of time this morning. Next week, I'm going to go to the mailbag. We do a couple of questions came in that we just ran out of time that we're going to get answered as soon as next weekend. Folks, if you'd like more information on this subject or any of the others that we've covered on this show, simply head on over to theburlingtondentist.com. There's a wealth of information there, theburlingtondentist.com. And again, if you'd like to get a question answered right here on these very airwaves, simply send that question to drbrennerradio@gmail.com. That's BRENNER. And that phone number, that's so important, 860-673-7155. Yes, you can call right now. Again, 860-673-7155. For Dr. Brenner, I'm Gary Byron. Until next weekend, have a good one, everybody. So long.